Well, thank you very much, Mr. Chairman. In the decade since Congress passed the HITECH Act to help spur better use of healthcare technology, we have made tremendous progress. Back in 2008, just 1 in 20 hospitals used electronic health records, and today we've seen that statistic flip entirely. 1 in 20 hospitals have not adopted electronic health records. We saw the impact of that shift nationally when electronic health records played an important role in understanding how the water in Flint, Michigan was putting families in danger. And healthcare providers have seen the impact of that shift in their work, as electronic health records have helped them identify health problems sooner so patients can get preventive care to stay healthy, avoid duplicative tests or medication errors, and identify treatments that might be counterproductive based on a patient's medical history or current prescriptions. But for all the promise of electronic health records, we've also seen the serious danger to patients when health IT systems fail to live up to high standards of quality. From the man in California who suffered brain damage after his diagnosis was delayed when a hospital's software could not properly interface with the lab, to the woman in Vermont who died of a brain aneurysm that might have been caught if a software problem had not stopped the order for the tests that she needed. Families' lives depend on making sure we get this right, which is why I was glad Congress, and this committee in particular, was able to take action in the 21st Century Cures Act to address some of the biggest challenges we face, and why I'm eager to hear today from our witnesses about how the Office of the National Coordinator for Health Information Technology is implementing the steps that we passed. While HITECH required certified electronic health record products to meet technical standards intended to make good information more accessible for care providers, a 2015 ONC report detailed how instead of making information easy to access and share, many organizations engaged in information blocking, intentionally setting up barriers between their systems and other systems, like exorbitant fees whenever someone sent, received, or even searched for a patient's information, contracts that restricted people's ability to access and share their own health information, and systems built in ways that made sharing information needlessly complicated. We've also seen how too many health IT vendors include gag clauses to stop care providers from speaking out about the problems or the issues and errors that they encounter. We cannot afford to have bad actors who prioritize their bottom line over patients' best interests, who block information that is essential to patient care, and who prevent people from speaking out when they see something that could jeopardize someone's health. Because when systems cannot speak to each other and people can't speak up about problems they see, it is patients that get hurt. That's why in the 21st Century Cures Act, Congress moved to end information blocking and make clear when patients and their care providers need information, they should not be stopped by unnecessary, unreasonable barriers. We then tasked ONC with clarifying what concerns, like privacy, safety, and security, would be grounds for reasonable exceptions. We also took steps to help ONC strengthen its certification program so they can require vendors seeking the government seal of approval to swear off information blocking and gag clauses. The new conditions also call for open application programming interfaces, APIs, another step that will help make sure systems developed by different vendors and used by different doctors are able to speak to each other, and patients have an easier time getting access to their medical records. These are important steps. I'm looking forward to hearing today about how ONC is working to carry them out. I'm also eager to hear about how the Centers for Medicare and Medicaid Services is working on a parallel track to make claims data more accessible and prompt care providers to be better about sharing information. I hope during today's hearing we can also focus on how to make sure health information technology doesn't just work for providers, but for patients. And that means tackling patient engagement and usability so patients who are looking for clear information about their health can find more than massive binders and unreadable PDFs and stacks of CDs. We also need to make sure we are discussing what is required for all parties to be good stewards of the data people entrust them with, and supporting the development of technology and best practices to keep people's personal information private and secure. This is only going to become more important as tech companies and others introduce new products. mobile applications that empower people with their healthcare data, but are not covered by existing HIPAA protections. Patients should be able to expect tech companies are going to use their most sensitive information responsibly and give them the tools they need to be able to control how and when their information is disclosed. Our objective should be to make sure tech companies are putting patients in the driver's seat, not the other way around. So I hope our witnesses will be able to speak to the importance of that as well. Look forward to continuing our bipartisan work, Mr. Chairman, to help make sure health technology is informing and empowering patients and providers in a way that leads to better care and helps people live happier, healthier lives. Thank you.